Chapter 40 is about the principles of dermatologic therapy. The critical step in treating any dermatologic condition is an accurate diagnosis. However, there's other important components when selecting treatment. We have to consider the type of lesion, the medication selection that we have, the vehicle in which that active medication is to be mixed, and the method used to apply. I must take a moment just to stress that a thorough history is the most important step in the assessment of dermatologic problems, but here we're focusing on treatment. The skin's the largest organ. We know that primary function is to provide a barrier to passage of substances and maintain internal homeostasis. And think of the skin as three primary or main layers. The most superficial of the epidermis, the outermost layer is the stratum corneum. The second middle layer is the vascularized dermis, and then the third deepest layer, the hypodermis, or the subcutaneous, is where the adipose tissue resides. So when the stratum corneum is compromised, that interrupts that barrier, protective barrier, and that is a consideration for treatment. The other important consideration is in the older adult, the skin is thinner, drier, less elastic. So you've got to remember that when you are considering your prescribing. Medications, there's really regional variation in drug penetration. So what by that I mean is thickness of the stratum corneum. There's an inverse relationship in the thickness and the drug concentration. So the thinnest skin we know, the thinnest stratum corneum is on the eyelid, and the thickest skin is on the soles and palms of the hand. So there's that relationship in how you select concentration. We also make consideration of vehicle. So with that I mean if it's a cream or a lotion or a powder, and we'll go over that in a minute, and concentration and the amount and application instructions. So I really like how our book briefly and concisely talks about consideration of the size of the area to be treated, the frequency of that treatment, and the expected healing time. And they give us a few different parameters. 1 gram of medication covers about a 10 by 10 centimeter area. Ointment covers a slightly larger area versus creams. So 30 grams for an entire body is typically all that's needed. And you'll see that written like when you're going to prescribe permethane cream for scabies. It usually comes in a 30-gram tube. And then there's the fingertip unit method, which is from the distal fingertip all the way to the proximal crease of the finger. That's about a half a gram area. So you can also calculate your needs by fingertip. But look at table 4.1. It gives you a nice, concise overview of this. And that way you'll know what size tube to order. So let's look at vehicles, because we know they affect drug absorption, and there's also therapeutic effects of the vehicles, such as hydration, cooling effect. Interesting, drug absorption is increased about 10 times with occlusive dressings. So people that occlude a steroid over a patch of psoriasis or a plaque of psoriasis could potentially get 10 times the potency. So vehicles that we generally talk about are powders, oils, liquids. All dermatology meds really need to be applied in a single thin layer. And we need to tell patients over and over, thicker application doesn't increase skin penetration or the effectiveness of the medicine. So one thin layer. So let's look at ointments. That's water and oil, excellent lubricants. It's the most potent due to that occlusive nature or effect of the oil. But it's not good on hairy areas, and it's generally people don't like it if it's going to oil up their clothing. So a lot of people don't like ointments for those reasons. Creams, they're slightly less potent than ointments, but stronger than lotions. It's a semi-solid emulsion of oil and water. It can be washed off with water. It's very good to be used on the palms and the soles. Lotions, it's a powder and water. It's definitely less potent than the last two. It's used for moist or hairy or large treatment areas. It has a nice cooling effect on skin. Solutions, that's water with a combination of medication or substances. Bath soaks to cool and aid in drying of exudative lesions, you'll see solutions used. Open or closed dressings, infected dermatosis, and hairy areas are also great places to prescribe solutions. Gels, that's an oil and water in a semi-solid emulsion with an alcohol in the base. They're transparent, they're colorless, they're excellent for hairy areas. They kind of have the therapeutic advantage of an ointment with the cosmetic advantage of the creams, but they tend to be a lot more expensive. So then the last drug that's really looked at in our book, although briefly, is topical steroids. And that's just because of the tremendous use of topical steroids for many dermatology conditions and diseases. We know that they work to reduce the inflammatory response, they vasoconstrict, and they also decrease collagen synthesis. They're available in several classes of potency, from low to high, or super high even, I think. Look at table 43 on page 244, because it's very important that you understand the potencies so that you can prescribe the correct drug, okay? Because if you're going to prescribe a low potency steroid for psoriasis, it's not going to work. And you know that you have to think, okay, where is it at? Where's the psoriasis at? Where does it cover? You know, who is that client I'm prescribing it for? So there's many considerations we just discussed, but the potencies, you keep that table available for you as you're learning about which ones to select. Unfortunately, those moderate to high and super high potency steroids, it can have adverse effects over time. They can create striae and tissue atrophy. Some of that can self-correct with discontinuation, but a lot doesn't. And then I think it's important for us to realize class 1 through 4 should never be used on the face or genitals. So patient and family education, keep the treatment as simple as possible. Prescribe enough medicine to complete the therapy. That's why we talked about knowing what covers the body, how often, how long do you anticipate this therapy is going to last. Educate whether to moisturize the skin or not before treatment. In other words, to pre-wet it. So those have to be written instructions that are given. How much medicine to apply? Is it a pea size? Is it a dime size in the palm? You have to be descriptive and you have to be concise. What kind of dressing? Is it a dry dressing? Is it an occlusive dressing or not? And how many times do you wrap it? How many times is the dressing changed? So being really precise with your orders. And what are the adverse reactions that could happen and what to report if it does? And then be very specific with follow-up in the clinic so you can ensure that the treatment you've ordered is therapeutic, it's effective, and that the patient understands that if they're not seeing a positive response, that they should follow up even sooner. So always making follow-up part of your plan of care. Thank you.